work through it. All right. Good morning, everyone. Welcome to our general office hours for the CalAIM Reentry Initiative Learning Collaborative. As a reminder, here's a bit of housekeeping rules. This is a forum intended for state and county correctional facilities, behavioral health and public health agencies, as well as reentry providers, managed care plans, and other key stakeholders with a significant role in the implementation of the CalAIM Justice Involved Reentry Initiative. While presenters are speaking, all attendees will remain muted. If you would like to speak, please use the participants tab and click on the three dots next to your name and select ask to unmute. Please utilize the Q&A box for questions only. Thank you for your cooperation and ongoing support of the initiative. And let's get started. Next slide. All right. So just to take a look at where we are in our training timeline, today is the general office hours for session 4 of the non-behavioral health services. The recording for that session that we had earlier this month is on YouTube now. We will put the link in the chat box and get it out to you as well, to all the attendees on our list. And as a reminder, our next collab training sessions for November will be on enhanced care management for GI. And then our November learning collab session, just a reminder for the office hours, there's only going to be one because of the Thanksgiving holiday. So we'll only have that general office hours next month. And also another reminder, everyone may enroll for any session via the Medi-Cal learning portal at learn.medical.ca.gov. And that's all we have for our timeline. So next we have about 4 open questions from the last session that were left open, and we have responses for those now. So I'm going to kick it off to Ashley, if you want to start us off with the first question.
Good morning, everyone. My name is Ashley Deli. I'm going to go ahead and kick us off with some of these pre-populated questions. So the first question you see up on your screen is, where can I find additional information about the behavioral health codes that have been added from Short Doyle to CAMUS? So on the screen, you'll see several links. The first link brings you to a published JI article that is specific to the billing codes for the JI pre-release services. Following that is the link to the Medi-Cal rates page where you may find the rates for these billing codes. The next link includes a link to the JI section which is a new section that was recently published in the Medi-Cal Provider Manual. And lastly, I just wanted to flag that the final slide of this presentation actually includes additional resources for you related to Medi-Cal billing and claiming. Next slide, please. The next question we have today, are managed care plans required to include fee-for-service JI billing codes in their ECM provider agreements? And so the expectations are that managed care plans ensure that all JI ECM providers with whom they contract are able to bill Medi-Cal fee-for-service for pre-release and care management services and/or receiving the warm handoff. This is accomplished by enrolling via PAVE or by establishing contracts with the correctional facilities to bill for services under the correctional facility NPI. Now, managed care plans may ensure that their contracted providers meet this requirement by including it in their provider agreements. However, DHCS does not require managed care plans to include specific fee-for-service codes in their provider agreements. However, managed care plans may include billing codes or references to other DHCS resources on care management bundles at their discretion. And the last link that you see here on this slide includes the standard ECM provider terms and conditions. And you will want to reference sections 14 and 15 for the JI ECM specific provisions that managed care plans may leverage with their JI ECM provider contracts. Next slide, please. This question, are there resources available to assist correctional facilities or correctional health providers with revenue modeling for JI billing? So to answer this question, the response is no. We do not have a revenue model for JI billing. However, we do include a link on this slide, and that includes CMC developers, vendors, and billing services directory is a resource for providers and billers that are interested in automating their Medi-Cal claim submissions. And so at this link, you'll find additional entities for related billers or clearinghouses with whom the county correctional facilities or correctional healthcare providers may contract with. However, I did want to note that stakeholders should verify directly with the companies listed in this document to ensure, verify what services they're currently offering, as this list has been compiled over several years. And we're going to go on to the next slide, where I will kick it back to Luana to wrap us up. Okay.
Oh, I got it.
Good. Just want to make sure.
Yeah. All right. Question is, if an incarcerated individual is released before they are enrolled in Medi-Cal and before they receive any 90-day pre-release service, does DHCS require the correctional facility or correctional health care entity to contact the county behavioral health agency and the county or the individual's county of release if they have a especially mental health need? The answer is yes. This is considered part of the behavioral health link. All correctional facilities, county behavioral health agencies, and managed care plans are required to implement behavioral health links regardless of Medi-Cal enrollment and receipt of pre-release services. County facilities are required to contact the county behavioral health agency within 2 business days of behavioral health needs identification to ensure assessments for services and appropriate behavioral health links occurring to mutual agreed standards between the correctional facility and the county behavioral health agency. There's also information on the short-term model. The short-term model requires behavioral health links to occur for individuals who have a GI code that has been active for at least 7 days. More information on that, it's actually part of the California Penal Code, section 4011.11. And that is question number 4. So let's now open it up to the open Q&A questions, and I'll hand it back over to Ashley and Maya to lead us off.
Hi, everyone. Good morning. This is Maya Shasha with Manat Health. Just want to encourage everyone to submit any questions you may have in the Q&A box at the bottom of your screen, as Luana described. We can get started with the first question that we see from Rebecca, who asked a question about community supports connections. Rebecca asked what the vision is for how incarcerated individuals will get connected to community support services, who is responsible for connecting that individual, whether that's an ECM provider or pre-release care manager, and asked a little bit about the pathway for the provider to make referrals prior to release so that services can begin on day of release. So Ashley, I'll turn to you to kick us off or direct to others on your team if helpful.
So I can answer that first part in general terms. So it's going to be a combined effort between the pre-release and post-release care manager to help connect that member with those community support services. And I don't know if anyone else on the team would like to add to that.
I'm happy to add in a little bit more because I think some of the ECM subject matter experts may be out of office today. But just reinforcing what Ashley said, it's the responsibility of the pre-release care manager, who may be the in-reach care manager, who will continue with the individual post-release as their ECM provider, or maybe a correctional facility embedded care manager. DHCS is requiring that there is a JI liaison at every managed care plan who can serve as a point of contact on topics like community supports, and help to coordinate those services. And the expectation is that referrals can take place prior to release if the managed care plan is known, so that the services can begin upon the effectuation of that managed care enrollment. Rebecca, let us know if you've got any follow-ups, but we will move on to another question. We have two questions that are a bit more logistical, but maybe are helpful to just say out loud, Ashley. Just someone asking about where they can find the slides for both this and the learning collaboratives, and then also someone just flagging that they had issues clicking on PDF links. I know we've included a lot of links, so they flagged that they weren't able to click into those links as the material is distributed.
Yeah, sure. So what I would recommend to the individuals who posted it in the Q&A about this is, if you have not received any of the emails that contained a culmination of all our prior Learning Collaborative materials, please send an email to our inbox and we can make sure that you get that information, and that copies of today's materials will also be provided via email. And I believe if those have not gone out already, that they will be submitted or sent out shortly after this office hours. And if someone from the team could put in our inbox email address in the chat, that would be awesome.
We'll get that in there. And also want to invite people, if you do want to raise your hand and ask your question live, that's also totally fine. But we've got another question from Erliana in the Q&A asking about any recommended tools or models for correctional facilities to use for Medi-Cal revenue, understanding and anticipating what might be received, if there's any recommendations for that, or if that's something that we should follow up with via email or after this presentation.
I'm thinking we'll have to take that one back. I don't have any of that information available at the moment. But yes, we'll take that question back.
Great. All right. We will circle back with that one at a future office hours or in written materials. And once we route that through subject matter experts. And just waiting to see if we've not got any other questions in the question box. So if folks have a question, want to raise their hand or pop that in the box, we'll give it another minute or so. All right, I see a few coming in. Let's see. All right, we've got a question on behavioral health services asking if county behavioral health agencies who receive a linkage from a correctional facility for a short-term stayer where someone hasn't been enrolled in Medi-Cal, what expectations may exist for that individual, or for reaching out to that individual around enrollment in Medi-Cal and receiving post-release services. I'm not sure, Ashley, if this would be for you or if we should pass to Luana for behavioral health.
I need a little time to look at that, so let's take that back for right now.
Yeah, I was trying to reread it. So let's circle back to see if I completely understand what they're asking.
Great. I see a question about billing. Someone's asked if DME is billed through CAMUS or through Medi-Cal RX, if it's possible to give clarification on that, or if that should be a more detailed follow-up response. We can also take it back.
I'm going to see if one of my colleagues, Caroline, would like to speak up on that. And if she doesn't, we can take it back.
I can answer some of that. So DME for larger items would be like wheelchairs, things that are more permanent and reusable. And those items are billed through CAMUS, and you must have a HCPCS code, and there needs to be a TAR prior to a treatment authorization request. For medical supplies, disposable medical supplies, most of those, even though they're sometimes referred to as DME, are billed through Medi-Cal RX. Enteral nutrition is billed through Medi-Cal RX. Enteral nutrition also requires a prior authorization. So prior to billing, correctional facilities should check the covered product list or the contracted drug list to confirm the item is on that list. If either item is not on the list, then it would not be billed. There are some medical supplies that have both a HCPCS code and a NDC code. NDC codes are needed when you bill Medi-Cal RX. So under those circumstances, it would depend a little bit more on how the medical supplies or the purpose of the medical supplies are given. And there's a list of DME products as well if you look in the provider manual. Does that answer the question?
We can maybe get a follow-up if there's any further, and we can also take it offline if there's some specific questions. I did see that we got a follow-up from Rebecca on that first question that we tackled, asking about how community sports referrals should be billed by the person developing the referrals or the pre-release care manager, and how that sort of reimbursement would work. So if a completed referral was made to community supports with all needed appropriate information, that would be billable under Care Management Bundle 2. And just reiterating that the managed care plan is expected to accept that referral and provide authorization, but as community supports are paid for under managed care, it's not reimbursable prior to release. So it's really, that's thinking about Care Management Bundle 2 is for pre-release making that initial referral. Rebecca, let us know if you have any further questions.
That's helpful,
Alright.
thanks. I think it was just thinking about the community supports provider, and they would just basically not be in a position to do any billing until they're starting to provide those CS services then, post-release. Okay.
Yep, yeah, it's a managed care benefit. All right, just sorting through the questions that we have. And I know, Ashley, I saw that we got a response from a subject matter expert on that initial question on tools and calculation models. So maybe we could revisit that and just speak it out loud. Let me know if you don't have it, and I'm happy to read it out.
Sure, I can provide a response. So as we know, JI just recently implemented, and so we do not currently have any statistics. It would depend on facility and county, but we are currently tracking payments for the first 3 counties that have implemented. And we do anticipate having some general dollar amounts within 3 to 6 months. But again, this depends on how many claims the counties submit. But we do anticipate more information for that will be forthcoming within the next coming months. And I'm looking in the chat here, and I saw a question pop up about billing guidance. It looks like this is a question from Joe. Is there a billing protocol manual we are still waiting on? Is there an update on timing? And I do have some of my colleagues on the call from the CAMUS side of the house. But my understanding is that there isn't any additional manuals that are set to be released. The current resources available to you for billing include the JI published article that was provided one of the slides, and we can drop that in the chat. The Medi-Cal provider manual, specifically the JI section. And we do encourage, there's going to be some additional training that is going to be announced soon for some more training, and it'll get a little bit more into detail regarding billing that we encourage stakeholders to attend. Is there something in particular that you were looking for that you have not found in the resources that are currently available?
Hey, thanks, Ashley. I, no, I mean, I think there's always still like questions. And I think in the back of my mind, I was thinking, isn't there a manual coming up? But I'm hearing that there's not. And so I might have just misremembered that. So that's my bad. Um, since I'm on unmute, I just want to say like those links would be so great. And I'm responding to that thread. But I think when we got like the whole PDFs of the presentations, the transcripts, all of the above for the past 5 or so, those are unclickable. So I'm going to respond to that, but like for us to be really able to like follow your lead on this kind of stuff, would be a technical issue that would be helpful to resolve.
Awesome. Okay,
And
so maybe
like,
we can explore a different way to ensure that you get those links following the
yeah,
presentations. Okay, I
yeah. So
appreciate that feedback.
maybe even for like this call, if those links you want us to be able to access, if those can just be copy pasted in the chat here, I'll like click into it and we'll be good to go.
Okay, sounds good. And I just did want to add, we do have a few links that Alice has graciously added here. There's the Medi-Cal GI page and the Medi-Cal provider manual. And looking ahead, there's some additional links that our Manat partners added as well. So yes, we'll make sure those links get posted for you.
All right, thank you. I think we've got just a level setting question that Donia is hoping to answer, just asking about whether entities like Kaiser and Central California Alliance for Health are considered to be managed care plans or enhanced care management providers. If there's someone on who wants to talk a little bit, just to remind people of the distinction between what the managed care plan is versus what an ECM provider is. And I think I can get us started, but others can chime in. So Kaiser and Central California Alliance for Health are managed care plans. And just to be clear, the enhanced care management provider is the post-release care management provider contracted under a managed care plan. So they deliver the care versus the managed care plan, which is someone's health plan. Others add in if there's more. All right, I'm just taking a look through to see if we've got anything else coming in. I know we had a couple billing questions that I think, Ashley, you addressed mostly. I see some that are very specific and wonder if the right move is for them to contact the JI inbox for very specific TA on questions related to billing.
Yeah, I think that sounds reasonable. I can provide a response to one of the questions. Will DHCS be releasing a complete list of fee-for-service service codes that are billable under pre-release services? And my CAMUS counterpartners keep me honest here, but my understanding is no, that we're not providing the entire list of all the codes that are billable. We have offered some of the codes and some of the resources currently available, but I think some of those E&M codes, that would be something that would be referenced in like a CPT manual. And I'm not sure if we have a link to that, but let's see what we can offer.
Thanks, Ashley. That was my question. I think it's been very helpful on the behavioral health link side to get the list of the JI warm linkage codes. And I think a similar resource for the correctional facilities to use for pre-release would be very valuable, particularly as so many of them are instituting EHRs for the first time, and using third-party billing administrators for the first time. To have a set code, list would be just streamline things tremendously. So thanks. If you could take that back, that'd be fantastic.
Yeah, and it looks like, Rebecca, I did want to add that looks like Alice did include a link to the CPT codes in the chat, and that these are the codes that are managed by CMS. I'm not sure that, and Camus, please keep me honest here, I don't believe that we're going to, extract from that and really identify which codes are specific to pre-release services. I think that's why stakeholders are encouraged to work with third-party billers and certified coders. But if anybody has anything else to add on DHCS's side of the house, please chime in.
All right. I know we are getting some written answers from folks, which we will drop into the chat or speak out loud if they come through. Just wanted to acknowledge that we've gotten a question on the JI aid code, asking if the correctional facility doesn't terminate the aid code on the day of release, i.e. if there's a delay in entering it, but Medi-Cal's reactivated or unsuspended, if managed care plans will be able to proceed with providing community-based services. I don't know if we've got our subject matter experts on the JI aid code. I don't know, Ashley, if you want to start it off, or this may be one for us to take back and make sure that we've got a full set of information and bring back to the next office hours.
I was just reviewing the question. Yeah, let's go ahead and take that one back just so I can talk to the eligibility side of the house.
Super.
And then I just wanted to add that for everyone to please reference the chat. There's a lot of different links coming in to assist.
And I know we've just got one question asking if it might be possible to just share these links in the post-meeting materials. Does that sound feasible, Ashley, just to make sure that they're clickable?
I'm sorry, Mike, can you repeat that?
Just a question in the chat. Okay.
Yes, Maya.
Okay.
Yep. So
Sorry, I got you, Ashley. Yes, that's okay.
yep, we'll send out all the links that are in the chat in the email that will come with post-meeting materials so that they're easily clickable. Thanks for those who flagged that there were some technical issues. All right, I know we've got a couple questions that we decided to take back. And I think I don't see any others coming in if others wanted to raise their hand and ask any final questions. Otherwise, I think we've come to the end of what we had submitted. And I don't
Hi,
see anything
Maya.
else. Oh, yes, go
Yes.
ahead.
This is Megan West at Placer County Behavioral Health. I have a follow-up to my question regarding short Doyle billing codes for peer, specifically certified peers. So I had submitted a question on that and I'm referred to the Medi-Cal billing manual, which we have and referenced, but the only certified peer codes in that manual, there are 3 actually. They say JI warm linkage, no. So I don't know how we can bill for them when are some of these codes billable for JI, even though the column says no?
So Megan, let's try to talk through this. So are you talking about once the individual is released and they're in their managed or then their managed care plan having these services provided to them?
Specifically referring to services that would be provided as part of the behavioral health linkage. So I've got table 17 of the policy and operations guide listing that behavioral health is the dual responsibility, behavioral health and corrections. It's billable short doyle and could include peer support. Billed short doyle by behavioral health. So I'm just curious if that's the case, what codes can be used?
Okay, so I know that specifically for receiving the behavioral health link, those specific codes that are listed in that spreadsheet are the only ones that are billable via short doyle as part of receiving the behavioral health link. But it looks like in your question that you had identified 2 codes that you would typically use for those services that have flagged no. Is that my understanding?
Correct. They call out peer services. So it seems to be conflicting with policy and operations guide that they're listed as no, or we need to know what the codes are that we would use for those warm linkage receiving peer support services.
Okay. Well, let's take that back and see if we can provide a better response for you.
Okay, thank you. I've submitted those details just Tuesday afternoon with
Okay,
the references to the table 17 and everything. So
okay, awesome. And those went to our inbox?
yes.
Perfect. Okay, thank you.
Thank you.
Great. And I see that we got a Q&A answered, which might be good to read aloud, asking, are licensed clinical social workers considered or providers for CalAIM JI? And we've just gotten a written response from one of our subject matter experts that LCSWs may be considered or providers, ordering, rendering, and prescribing providers. So hope that's helpful in case there's anyone just listening in. I think we're winding down with the number of questions that we've gotten, unless there are any that folks are still answering. I know we have a couple to take back. Otherwise, I think Ashley and Luana, I can pass it back to you to close us out.
Thank you. Just as a reminder, the 5th learning session will be held Thursday, November 14th at 10 a.m. For billing training, please visit the Medi-Cal Learning Portal to register for and access the JI portal and Cal billing training sessions. And you can also email us any additional questions at CalAIM Justice Advisory Group at dhcs.ca.gov about the GI program, anything we talked about today. And we just want to say thank you for joining us today and have a great weekend. And we'll see you guys later.